One of the things that is challenging to me is that the idea that depression is related to low serotonin or deficiencies in serotonin was never reliably proven up to the point of when we pushed on antidepressants, and it's never been confirmed.
It has.
Well, there's many people in your field who completely deny that.
I know we're disagreeing. It's okay, but I want to be clear. There's virtually this isn't controversial in the field. I understand
it's quite controversial. I have a very large platform that is now in the top 0.05% related just to these ideas, and I've had plenty of other psychiatrists on here where we've talked about the same thing. So, what do you know about the Moncrief study 2022, the umbrella study on serotonin?
I know it well. I've read it multiple times. I'm familiar with it.
I don't want to speak for Joanna Moncrief, but would you be willing at any point to have a discussion on the podcast with myself moderating it with the two of you, so you can just Joanna Moncrief? Yeah.
I mean, I'd be happy to. I mean, I'd be happy to. That'd be fine. I mean, but that was her. Those were her.
So I think you might be misrepresenting her position, and I think the burden.
No, her position was that the data aren't consistent or convincing. But
exactly.
In the results, she reported a relationship.
Yeah, I think and I don't want to speak for her, but I think if she was communicating this, she said, when you identify a causal relationship, like low serotonin equals depression, and that drives the mass use of a pharmaceutical that targets that, and there's no definitive proof that anyone who has a severe major depressive disorder has deficiencies in serotonin, we can't communicate that. Like that's an invalid way of being able to describe a relationship. It's on the burden of proof is to prove definitively or clearly that there's a causal relationship because we're targeting it with a drug. If there's no brain activity and consciousness exist, now we're going to reduce the complexity of the human experience, like mood and depression, to like one neurochemical that we've been able to identify, something as complex as serotonin. It almost seems like ridiculous to even talk about it. Like, what are they going to say 50 years down the line, looking back at conversations like this?